Dr. Cline here. This video is intended to help go over some post-op discharge instructions for your pet's dental procedure today. When you pick them up today, they will have an area where their arm was shaved for an IV catheter that allowed us to give them IV fluids and IV anesthesia while they were in for their procedure. During the dental cleaning, we perform full mouth dental x-rays to look for any disease below the gum line that needs to be addressed. Your pet gets a full scaling and polishing of their teeth. We perform laser therapy at the conclusion of the dental to help reduce any inflammation and help with any post-op pain control that is needed. If your pet today did not have any extractions, then going home, everything is pretty routine for the most part. It is very normal for them to be pretty sleepy after anesthesia, and every animal recovers a little bit differently at home. Your pet may want to go home this evening and have kind of normal energy and want to eat dinner. You can absolutely offer them some food this evening. If your pet is not interested in eating tonight, I would expect their appetite and attitude to be pretty much back to normal by tomorrow. Sometimes older pets can take a little bit longer to recover from anesthesia, and so we may see a full 24-hour period or so until their appetite and energy level is back to 100%. But if you go home this evening, offer dinner, and they're not interested, that's not unusual, and I wouldn't worry too much. If they don't eat breakfast tomorrow morning, maybe just give us a call and we'll make sure that everything is okay. Typically, if there are no extractions or any other kind of oral surgery performed, there won't be any kind of post-op medications to go home. For those pets that do have dental extractions or any other kind of oral surgery performed in hospital, there will be some post-op medications often to go home. We'll have one of our technicians or assistants go over that with you at the time of pickup, but those often will include either a non-steroidal anti-inflammatory medication, which for cats we typically send home meloxicam, for cats or for dogs typically carprofen. In some cases in cats we will use a long-lasting transdermal opioid medication to help with additional pain control, and we will go over that with you on a case-by-case kind of specific basis. If your pet did have extractions, then there are sutures in their mouth that are going to take a couple of weeks to heal. Those sutures will dissolve on their own, so you don't have to come back to have anything removed, but depending on how extensive extractions were, we may recommend post-op follow-up in 2 to 3 weeks just to make sure that everything is healing well. Because there are stitches in the mouth, it is really important that we do everything we can to make sure that those don't open up or dehiss. That is always a potential with dental extractions, and ways that we kind of help to mitigate that is having you feed soft food at home. So if your pet normally eats kibble, then I recommend either switching them to a soft canned food if that's not going to upset their stomach, or if we want to keep them on kibble, then warm it with some warm water for maybe about 10 to 15 minutes and let it sit and soak before you give it to them. After extractions, I do recommend to feed softened food for 10 to 14 days. I would take away any kind of chew toys that they potentially are playing with daily. Even if they like to play with stuffed animals pretty hard, I would take those things away. No kind of dental chews or anything like that for the next 2 weeks. If your pet had extractions performed, then we've also used local dental nerve blocks in their mouth to help keep them numb. These dental nerve blocks can last anywhere from 18 to up to 48 hours sometimes, and so it is very normal for them to be numb. Sometimes you will notice a little bit of increased drooling at home, which is totally normal. You may notice a little bit of blood tinge in that drool, which is to be expected. If you notice any significant bleeding or anything else that you're concerned about, definitely reach out and let us know. We're always here to help answer your questions. And of course, after anesthesia in general, if you notice any extreme lethargy, weakness, again, uncontrolled bleeding or any significant bruising, then we do recommend to seek care at an after hours facility if we're not open, or bring them back in for a follow-up with us. If you have any questions, definitely feel free to reach out to us, and we of course will be available to go over everything in person when you pick up your pet today. The final thing I wanted to talk about after all dental procedures is starting a really good at-home dental care regimen. So now that your pet's teeth have been cleaned, we have kind of gotten them back to baseline. So if your pet did not have extractions, we can pretty much begin at-home dental care immediately in the next day or two. If there were extractions, then I usually like to wait until the gums are fully healed, stitches have resolved, so about 2 weeks before we start any kind of extensive at-home care. The number one thing that's going to be helpful for your pet after having a full cleaning is doing something daily to remove dental plaque. Plaque will start forming within a matter of hours from the dental procedure, and if we're not doing something daily to remove that plaque, that's when it ends up turning to calculus or tartar, and we are more at risk for developing periodontal disease when that happens. So we will send you home with a sample of dental wipes. A lot of people like using those. You can kind of wrap them around your finger, and you're going to wipe the outer surfaces of all 4 quadrants once a day. Some dogs and cats prefer brushing, which is perfectly fine as well. So they make specific smaller toothbrushes that you can use for dogs and cats, even the finger brushes, and then usually some type of enzymatic toothpaste. A lot of it is still just the mechanical action of being able to manually get in there and remove the plaque that's building up daily. So I do recommend that, as well as combining it with some other type of dental product, 1 or 2 things typically for most animals. So if they won't allow you in their mouth, as far as trying to brush or do dental wiping daily, then it's really critical that we add something else on adjunctively. So there are really good water additives that you can put into their water daily to kind of help reduce plaque buildup. There's also powders that can be added to the food to help reduce plaque buildup. And then in combination with those, I think a good dental chew daily is recommended. I will be sending you over some written discharge instructions, and I will put in all of my recommended products in that paperwork. So if you could be really good about establishing a good at-home dental care regimen that can include hopefully daily brushing or wiping, plus a water or food additive, plus a daily dental chew treat, this is going to be ideal. Every pet is going to build up tartar and plaque in a specific timeline. So some animals build up really quickly, other animals doesn't happen as fast, and genetics can play a huge role in that. And so since we can't control that part of it, trying to do as much at home as we can to help is good. So usually we like to see these guys twice a year to evaluate their teeth and kind of discuss when the next dental cleaning will be needed.